Okay, what we're looking at a reverse curve in the neck, significant degeneration, but also huge dental toxicities, cavitations, but mainly this is the area here. The heart has two nerve supplies, so what we're looking at is a patient that had significant cardiac arrhythmias, and on the EKG, talking a totally abnormal finding. The challenge is an EKG measures the nerve activity here, not the sympathetic nerve supply or the parasympathetic nerve supply to the heart. So T1 through T4 is the sympathetic nerve supply, and we can see there's obviously a structural aberration there. The parasympathetic nerve supply is in the cranial nerves up here to cranial nerve 10, and with a reverse curve in the neck, that's significant. This patient had extreme dizziness, heart palpitations, misdiagnosed as a right bundle branch block. So now we're taking care of the dental issues, the root canals, the cavitations, and I'm going to show you how to work with the cardiac arrhythmias. So we're going to start off in the prone position, and this is a cervical challenge. So lining up, seeing how the leg lengths are there coming in the suboccipital area. There's a significant tone on the left, so I'm supporting the occiput on the right, challenging the anterior to posterior direction, slightly superior to inferior, and there's a significant change. The reason this is because we don't have conscious control of these muscles. They're called postural muscles. By changing the tone of one half, that changes the pelvis. I'm going to go at a slightly different vector, a superior to inferior, more lateral to medial, to double check, and that one's not as good of a correction. I'm going to start off with axial traction on both aspects of the lumbar. There's not a significant lateral deviation. And then on lateral flexion, because there is a resistance on straight axial traction, I'm going to apply a small vibratory influence on the contralateral side, loosening up the ligaments to allow me to get more movement to change the tone of those paravertebrals. Now it's functioning correctly, where on lateral flexion, the inside portion or concave portion of the spine should be relaxing. Now it is relaxed. So I'm going to set the drop table and do a very, very gentle drop. Now let's take care of the thoracic area. Remember, there's a significant right concavity right over the nerves that supply the heart. So first, I'm going to have her turn her face to the right side. That preloads the spinous processes. Now I'm going to work the tissue on the inside portion while palpating the convexity. And I can feel the fluctuation there. Now I'm going to contact the spinous process and do a very, very gentle adjustment. Go right back in the middle. That's going to derotate out that upper thoracic area and take care of the sympathetic nerve supply that supplies the heart. Now, this is about 5 weeks into care. Before, when she started, could barely stand up in the shower, couldn't move her, literally wash her head. Now, she balance issue is almost completely resolved, and the cardiac arrhythmias are almost completely resolved. But that's doing it with the detoxing, the adding the nutrients, and the spinal corrections. Go on your side, face me. Now this is to correct the C1, top bone in the neck, and you'll see just a very, very gentle contact in superior to inferior, anterior to posterior. On side posture, you'll see there's almost no rotation. So very gentle pressure until I feel a change in tone of the muscles. Go right under the back. Those paravertebrals, there's no conscious control. Now, I'm going to check the plates of the skull, because since all the adjustments we're doing are actually changing the brain's awareness or proprioception, if the plates of the skull are misaligned, then the brain can't fully get the right nutrients and it won't function as well. Then you'll see the head's not turned hardly at all during the cervical adjustment, but we have to correct that reverse curve. So I maintain pressure, just changing the tone of those muscles by changing the joint mechanoreceptors. And this is a spinous process push. Maintain the pressure just for a moment, and then a slight impulse. I'm going to contact the C5, C6, and again, that fraction of a second weight changes the tone of those paravertebrals. Now I'm going to take care of that significant left convex and the upper thoracic area first. Applying pressure on the lumbar, and now with a gentle rotation, the nerve supply of the heart's corrected as well. Rise up, correct the nerve supply that supplies the heart, detox the body, and then do better.